Good morning. We are here today with Marek Urbanowicz, who is going to run some CPDs with us at ICOM. Marek trained in Shiatsu in the 70s, actually studied for a year here at Green Hedges Avenue in the late 70s. Finished his training and gained a master's in acupuncture in the 1980s. And since the late 1990s, Marek has studied and taught Japanese acupuncture. And we're very pleased to have Marek delivering 3 CPDs for us at ICOM on various aspects of Japanese style practice. And we're going to talk a little bit about each of those 3 CPDs in the coming interview. Marek, thanks for being with us today. If we could start with the Sotai course that we're going to run, a 2-day workshop in early May. I imagine that not many people will have heard of this particular muscular movement therapy. Can you tell us a little bit about this form of therapy and what you intend to deliver over the 2 days that we run?
I think if people have done Shiatsu, they might have had a brief introduction to it, because obviously it is a Japanese system of muscular therapy realignment. But I learned it, or an aspect of it, in '98 when I studied with Stephen Birch. So I was studying the Manaka style acupuncture, and Manaka knew Dr. Hashimoto because there was a thing called the Japanese Topological Society, and they would meet, I think, monthly and discuss their ways of working and their recent discoveries. Hashimoto was a neurologist, a medical doctor and a neurologist, and he realized that at the time there was this emphasis on lots of strong physical exercise. And he realized that actually that for a lot of people that was detrimental to their general health. So as a neurologist, what he realized that was that actually if you went with what the body was already doing. So by that, I mean, for instance, if you have a tight hamstring, so the natural inclination for lots of people is to stretch it,
to do the opposite movement.
Yeah. So basically you're trying to lengthen it by rolfing or fascial release or something like that. Was actually what he would do. He'd compare the 2 legs, and so the tighter, say the right leg is shorter, quote unquote. Instead of trying to extend the length of the muscle, he would actually, on the out breath, he would ask the patient to bring their leg back down to the couch, and toward about 2/3 down in that movement, he would just apply gentle resistance for 3 seconds, and then he'd suddenly release it. And then he would leave it for 20 seconds, and then he'd recheck the range of motion, and lo and behold, the range of motion had increased. So he would do that 3 times. And always, if there was any pain, he would always stop before you got to pain, because he'd said pain is not part of this process. And I've been using it pretty much since I learned it with Stephen. I mean, Manaka incorporated about 5 different movements. And then since then, I went off and studied in the States. I did some training in the States, and then I did some training with a Spanish guy in London for a year. And I think it's a wonderful, simple way of improving range of motion, and also it works on, I suppose, obliquely it works on the sinew channels, or the tendon and muscular meridians, whatever you want to call them, which is how Manaka sort of incorporated it into his model as what he would call the stage 3 treatment, because stage 1 in his model is treating the front, the yin surface. Stage 2 would be treating, generally speaking, corresponding back shu points that related to. So if he treated, say, yin chao, renma on the front, he would palpate bladder 23, bladder 13, bladder 25, possibly on the back, and then he'd apply motsa or needle motsa on those points. But stage 3 would be his point where he'd want to look at the musculoskeletal structural aspect of the patient. So he was kind of trying to be holistic as much as possible, really. So it's just a very gentle way of working, and quite profound, and you get quite a lot of release from it, emotion, because people quite often, they get an emotional, psychological release, because all that tension they've been holding on to, the nervous system. And it's interesting that you do have this sort of, I've studied with various people, and there are a variety, like any therapy, the people go off in their own different kind of angle with it. But generally speaking, it's encouraged to leave a 15 to 20-second interval between each movement, which is a kind of similar to other therapies I've studied, like Feldenkrais. There's this thing of allowing the nervous system to acknowledge the changes that have occurred, and then you add in a bit more information. I think that's a really interesting.
With some idea of kind of neural reprogramming.
Yeah, absolutely.
You don't have to be tense. You don't have to be tense. You can relax.
Because otherwise people just go back to their own default positions of, we know as acupuncturists that, people are very, particularly if they've been, they've had the symptoms for a while, you make some corrections, if you want to use that word, and they go that part of them doesn't quite recognize what you've achieved there, because they're so used to having one shoulder up like this or being in pain that's their norm, even though it's not really a norm.
I find it often if you can release the tension, but then they still want to protect, and you kind of
absolutely
try and encourage them to let go, but it's that defense mechanism has been there for so long, you can't release.
So it forms like the last stage of a treatment, Marek. I mean, that sounds like a kind of branch treatment, but it's more than a sort of...
Yes, much more than, because then the stage 4 in Manaka would be to, treat the, being holistic, you treat the symptom last, if you like. You treat the roots basically, and then you treat the branch by the end of, in which case maybe much of that has kind of dissipated to some extent by whatever your root treatment was. So it's a lovely way of working, and it can be incorporated. You don't have to be an acupuncturist to do it. You could be a Shiatsu practitioner or a masseur or any other kind of body stroke, quote unquote, body worker, to incorporate that, because the principle is very easy to understand. Once you've got the idea of it, it also makes you look at the way people hold themselves very differently, I think.
So it's kind of, it's for correcting posture and also kind of musculoskeletal stuff that is also a kind of holding of emotion.
So there's an emotional, psychological component, and also about how the nervous system is, because obviously what innervates, should I say, the muscles is the nerve pathways. So you're having an effect not just on the muscle, but also on the way the nervous system the trigger. So otherwise, I know patients of mine, they say, I stretch my hamstring every day and it's still tight, and I'm thinking, well, that's because you haven't really addressed the underlying issue of just allowing it to release naturally. So
this therapy, I mean, physios could come along to it,
absolutely. I mean, it's, I think the biggest problem for people from that training is that they're trying to impose something on the patient, which is a very Western way of looking at things. Let's change this, rather than allow the body, mind, or whatever you want to call it, the facility and the ability to change it from the inside, rather than you're just there as the kind of facilitator of it, really. Just as acupuncturists, we're there to facilitate. We make a diagnosis, we use various points, and then the chi arrives, and then a process happens, and depending on the patient, it might be immediate. They get off of the couch and go, I'm not in pain anymore, I'm in less pain, or they notice a few days later, I haven't got that headache anymore, or whatever it is, depending on their rate of and sensitivity to change, really.
So the starting premise is that the body knows how to self-regulate, and we're nudging it towards that capacity to self-regulate.
And I think Manaka would, that his one, I mean, it's sometimes called Manaka acupuncture, but he also called it yin yang balancing. I think was one of the, so self-regulation, which is, that's idea in Feldenkrais and lots of other therapies. It's like there is an innate ability for the body to kind of go into a more homeostatic state. So we're there as facilitators of it.
Do you use the Sotai a lot in your practice?
Well, it depends on who, because I also use applied kinesiology quite a lot, but it dovetails with that. So anybody who uses muscle testing, as I do, and I've been using the two together for about 40 plus years. They don't conflict at all. So I use it, yeah, pretty much every acupuncture patient, I do it. And some people come in and they're in a lot of pain. And the nice thing about this is that you can do, it's very gentle. So because there are variations of this called Yin Sotai, which I would sort of talk about briefly at the end, which was developed by a lovely man, Bob Quinn in the States, who's done a lot of Japanese study, particularly the very non-needling contact type acupuncture, Toya Hara, and those kind of skills, which I don't personally use, but I know of. And so you can go as gentle as you want, really, with it. And sometimes when people are in lots of pain, actually you have to go very gently. And you get quite profound. They suddenly go, oh gosh, that's different. So you get what I love about it is changes happen on the table, on the couch, which is always a good sign, really, because it's not coming from here. It's like, oh, I think we need to do this. So.
And it's for acute presentations and more chronic stuff.
Oh, absolutely. Yeah, either, really. I mean, obviously, the more chronic ones take longer. And the nice thing is that you can then go give the patient homework to do, because you can do self-Sotai. So there are once you've got the general idea of what needs to be done, you can do that more. You can, if you've got the time. I mean, that's always the problem, is the patient compliant? I mean, I see a lot of patients who have physio and they've been given lots of exercises, but they're not that compliant about doing them. So,
I mean, it's got to be easy and doable, isn't it?
Yeah, well, that's the beauty of Sotai is it's very easy to do.
Okay.
It's not complicated. I mean, I usually check the following time I see them to make sure that they've concocted something completely different, because they do tend to do that. I mean, no disrespect to patients, but they can sometimes misinterpret what you've asked them to do. Sure. Or, I mean, I do it myself. Or you start changing it slightly, and then that change increases, makes another change, and by the time that they come back to see you a month later or whenever it is, they've arrived at a very different kind of movement, which isn't really doing what it needs to be done. So it's usually easily corrected, So.
Okay. And it's easy enough to learn
very easy. As a practitioner, it's very easy to learn. I think anybody who's used to any kind of hands-on work, which essentially we do, and I suppose TCM is a bit more cerebral. I mean, not ever having been a TCM practitioner, but, I did study it a bit with Angela and John Hicks many years ago. But that wasn't, I think, because my training initially was in Shiatsu and massage and reflexology. I was always quite body oriented. Yeah, the more kinesthetic. I'm very much at the kinesthetic end of therapy, really. So I like to trust what my hands feel. That's the thing with Japanese styles. It's very tactile. It's all very much about palpation. That's even though there are many different things in Japanese styles of acupuncture, the common thread is palpation.
Yeah. And which is how you diagnose and also how you evaluate.
Oh, absolutely. Yeah. So you would make your diagnosis in Manaka, palpating various, lung 1 or 2, or the right subcostal for the liver, or left kidney 16, or whatever it is. And you then see there's this pattern. You'd select your choice of points, and then you'd go back to that during the 10 minutes or so the needles are in, and you'd look for change. Yeah. And then if change wasn't happening under your fingers, you go, well, maybe I've not quite got the point in the right place, or maybe I need to add another point in to just, particularly with the liver, sometimes, I mean, most people have some kind of liver issue, even if it's more emotional and it's to do with anger and frustration. And you often had to add in some other points just to support the main treatment.
Yeah. But it's responsive to the
it's very much, it's diagnostic, and it's also feedback, which is what I love about. Much like Sotai, again, you're making a diagnosis as such about, this muscle has a limited range of motion, and then you're getting feedback. So it's a lovely two-way, rather than, okay, we'll give you this treatment and come back in a week's time and let me know how you feel, if it's done anything for you. you can see immediately, yes. And also you get an idea of, because some people, they suddenly get way more movement, and other people just get a little bit. So that in itself gives you a sense of how receptive is this person, at what stage of, particularly obviously the longer you've had something, as a general rule, the longer it will take to shift, you know.
Yeah, of course. And so on the 2 days of the Sotai, there'll be a lot of practical work as well.
Oh, absolutely, yeah. It's very much going through the basic philosophy of it, demonstrating what it is, and there'll be lots of people working with each other and then working with other people. So you realize how different one body is to another. Okay. And the biggest thing is that people try and they go, oh, I'm going to really do this, and you really resist. And it's like, no, the less is more approach in Japanese acupuncture. This is why the needles are half the thickness of a Chinese needle, and you don't twiddle them and go deep. You do shallow insertion, very delicate needling. The moxa is very highly refined. You know, it's very, the whole thing is very delicate.
It can be quite a cognitive leap, can't it? The idea that actually less is more, that you don't have to go.
Yeah. Well, it's so not Western, you know.
Yeah, exactly.
That's Newcomb, boys.
Yeah, exactly. So, Marek, that sounds great. Maybe we can talk a little bit about the Manaka. So you're going to run a 4-day course over 2 weekends in July.
Yeah.
Can you tell us a little bit about what you're going to cover on the over those 2 weekends?
Okay, so I mean, weekend one will be obviously the basic philosophy of Manaka. His idea that the body is like an octahedron. So you've got the Ren or conception vessel up the front, you've got the GV, Duma at the back, then you've got Daimai as the kind of bridge between the upper and lower part of the body. So you've got 4 quadrants front and back, and then the rest of the extraordinary, it's very much predicated on the extraordinary vessels.
Yeah, okay.
And that, you know, again, it's palpation based.
So palpation of the pulse, Marek, or the channels themselves?
No, palpation of mostly the torso. I mean, obviously pulse diagnosis comes into it, but it's not essentially a pulse-based system, unlike, say, Japanese meridian therapy, which is a combination of palpation and pulse diagnosis. This is very much a palpatory approach. So you would look and say, oh, right lung 1 and 2 are tender, left lung 1 and 2 is not tender. Right subcostal is tender, left kidney 16 is tender, but right isn't. So immediately you've narrowed down your diagnosis to, oh, it's probably this pattern, or it might be this pattern. And so for me, within about 2 minutes, I've made a diagnosis of what I need to do.
So there are a limited number of patterns which are easily diagnosable with.
Well, there's 5 main patterns, really. I mean, Manaka came up with some, and then since his passing, which, I mean, I sadly didn't meet him, but strangely enough, the first book on acupuncture I ever bought was A Layman's Guide to Acupuncture, which was by Manaka. And lo and behold, many, many, many years later, I ended up studying it. And then there have been more patterns developed since then by other people, like Oren Kivity, who's teaching he's developed one. There's a woman in the States called Brenda, and I've forgotten her surname now, but she's developed it. And I've come up with a few kind of ideas about, you know, what we could, but basically you've got either treating the extraordinary vessels or combinations of extraordinary vessels, or what's he calls the polar channels, which is based on the midday, midnight law. So you would treat, say, lung and bladder. So you treat the opposites.
Yes.
So it's that yin yang thing, which really it's all about what his thing is. You treat the yin and you treat the yang. You might emphasize one more than another, but you're trying to get a balance.
Okay.
So then stage 2 would be, generally speaking, treating the back shu points. You're treating the yang surface. Okay. As I say, either with needles. I mean, if it's on the upper back above T7, it will be shallow needles with moxa on the skin.
Okay. Or
if it's below T7, you do moxa needle, or what we would call kyotoshin, which is needle with a ball of moxa on the top. And then you'd to release the points, because it's obviously you've got a twofold impact there. You've got the needle and the warmth of the needle, and obviously whatever herbal properties that people like Merlin Young have come up with, all what Moxa is doing from a sort of quote unquote scientific perspective.
Yeah.
And then stage 3 will be Sotai. So those people who've already done the Sotai course, they'll be reintroduced to the Sotai.
Okay.
And if those people who haven't done the Sotai course, they'll get a kind of introduction to. I won't miss out that bit, but obviously having done a couple of days on it, that the people who do the Manaka course won't get quite as much. And then the second weekend will be reviewing what we've done on the first weekend, and then looking at more complicated patterns, that Manaka came up with. There's a whole body treatment, when somebody's completely exhausted and you feel like every channel is in a state of depletion. There are things like that. And there's also some more symptomatic, sometimes people come in with a sinus infection, or they've got, he's got a treatment for hepatitis. He's got treatments for pancreatitis. I had a patient years ago who had Hep C, which he'd got from a dodgy dentist, not from an acupuncture, a dodgy dentist, and he nearly died from it. And then he came to see me, and when you palpated his liver, it was like forgive the pun, it was like a block of wood, and Manaka has this wonderful treatment which he uses silver and gold needles. So he would use a silver needle on pericardium 7 and a gold needle on liver 3. Okay. And you could actually feel during the 10 minutes or so the liver soften, and he could feel it on himself. He'd palpate just under the right rib cage, and he said, that's so different, And he'd virtually, his brother had phoned me up to say, oh, is there any way you can treat him? And he was in hospital. And I said, well, the surgeon or whoever it is probably won't let me come and treat him. But he came afterwards, and he'd been seriously ill, and it was extraordinary. And then
how he recovered,
and it was actually noticeable on the couch, that he was changing. So those more complicated things were what, but obviously most of the time in my practice I'm doing the basics. Okay. And then every now and then you go, oh, you think, well, the patient got better, but they could be made. And I suppose I've also, because I've been practicing style of acupuncture since 98, so that's whatever it is, 25 years or something, 27 years. I've kind of refined it. I'm probably the most senior Manaka acupuncturist in the UK, because I know that other people who've studied Manaka, they often do, a lot of them often did Toyohari, which is the kind of non-insertive, which I thought was interesting, but wasn't enamored enough to study it, because I really liked the Manaka stuff. For me, it ticked every box, really.
And is that in terms of the structure of the treatments, or, why Manaka?
What I liked, so before that, I was very much I did a Likat, Biak and Emat with Worsley himself, one of these kind of legendary figures, brilliant man. I always felt I was still a little bit, I think this is probably the right treatments. So one of the appeals of Manaka was that you could trust your hands, that was, and having come from that sort of more kinesthetic background, it made a lot of sense to me. Okay. And then I like the logic of it. It's sequential model. So you do stage 1, which is treating the front, stage 2, treating the back, stage 3, doing Sotai, stage 4, treating symptoms, stage 5 will be giving homework. Okay. But it's an inclusive model. It's not rigid. It's not like, oh, well, you can't, because Manaka, if he was alive now, he would be using Yamamoto scalp acupuncture, probably included. So he included other things. So it was essentially what they call a syncretic model, which you take information from other sources and then build it into your model.
So how easy would this material be to integrate into an existing practice, say if you were a straight up TCM practitioner?
Okay. You'd have to have a bit of a mental shift, I think, about, you'd have to start palpating.
Yes.
You'd have to think with your hands rather than just with this bit, you know. I mean, this, I'm not denigrating this because it's useful, you know. But sometimes it gets in the way of like.
Well, and there's always a sense of abstraction from what's
yeah, absolutely, and it depends whether you want to be a clinician, I suppose, in a sort of sense, or will you want to be? You're more drawn to a hands-on approach. I think it would be. I mean, I think depends how wedded you are to TCM.
Yeah.
But I mean, if somebody was coming on this course,
they're looking for change. Anyway.
They're looking for some changes, you know, and even if you just included a little bit of it, and then go, oh, this is interesting, and of course, it also you're thinking, oh, I think I need to do this. You know, you think, is it Yinsha Ren Mile, is it this or this? You can palpate for it, you know, rather than thinking, well, I think it might be this, or let's put some needles in and see if it changes. You've got much more. You've got a direct palpatory kind of diagnostic method.
And Marek, how easy is it to develop that skill, that palpatory confidence to know?
Well, obviously,
stagnation or deficiency or whatever it happens to be.
All those things. The more you do it, the better you get. So I think my skill. I mean, I was in Japan 4 years ago, and we studied with this Japanese guy who was 80, and he was working in his grandfather's clinic, and his level of palpatory skill was, he was putting his fingers on along, and he said, oh, I can feel a little sesame of tension. And I'm thinking, really? Where? And I think, well, I'm not quite, I'm in my 70s, I'm not 80 yet, you know, but I've still been doing this for quite a long time. Yeah. I thought, but he was saying at 80, he was still seeing 60 clients a day.
Wow.
I mean, he's got a sister, his daughter was working there. So basically, he would do the quick palpation, he'd go find out what was wrong, and then he would kind of do what was necessary and then go to the next place. And then his daughter would do the mopsa side of it or whatever else was needed. Yeah. And it was treating a lot of children as well. So with children, you don't need to spend lots of time, but
takes less time.
And he would get up, he'd start at sort of 8 in the morning or something.
How extraordinary.
Just extraordinary. And he looked really just
vital,
you know, because obviously when you're doing something you love, I mean, people say to me, you're going to retire, you know, you're in your 70s now. And I'm thinking, don't understand, what does that word mean?
It's an anathema, isn't it?
It's not in my vocabulary, that word. Yeah. So,
and so, Marek, you talk about this very clearly delineated stages of treatment, but yeah. I haven't heard you reference it in terms of root and branch. Does that come into the way that you?
Yeah, so very much treating the front would be root.
Okay.
So, you know, what's the primary pattern, if you like? So in Worsley's style 5-element acupuncture, it would be what's the causative factor or the CF? Are they a fire type or a metal type? Yeah. So on. And then in TCM, you know, from my understanding, are they, you know, is it spleen deficiency or
it's an organ pattern?
You know, what's the predominant pattern? Yeah. And there's an overlay of other things, and you will recognize that. But you would go, the primary thing I need to work on here with this is this. Mm. And then that will then set you on a particular journey of, well, okay, so we've got, I don't know, Yang Ming or something, they've got sinus problems and you know, various things. And it's clearly a Yang Ming problem, and you treat that. And then you then the stage 2 would be, which will be treating the branch more, or perhaps an extension of the root. You would treat bladder 25 or bladder 13 or bladder 21, but again based on palpation, and you'd feel maybe actually bladder 21 on the right side is much more tender than the left. So so again you can go, okay, actually I don't need to treat the left side, I can just treat the right side. So okay. So again,
and so are you using different kind of dispersive and supplementary techniques in terms of your needle technique? That's the gold and the silver?
Just essentially even needle technique, really. And on the front, you're using things called iron pumping cords, okay, which are was developed by, so Manaka, being a medical doctor and an acupuncturist and a herbalist and a researcher and a poet and a sculptor, and spoke 5 lengths. So he was a polymath and a polyglot. You know, he's one of the. I mean, I'd love to have met him. I mean, Stephen Birch, who trained with him. I was lucky enough to study with Stephen over a number of years, because he still had that medical training. He was trying to explain to his fellow practitioners, or many of whom were also doctors, what he thought was happening with acupuncture. And he came up with this idea that acupuncture was balancing positive and negative ions, which is really another way of talking about yin and yang, but with it's just different language, really, but saying essentially the same thing. So I'll show you what an ion pumping cord looks like.
And so will you teach the students, will learn about this ion pumping cables?
Yes, well, you'll either I'll supply some or you will get some in. So this basically, you've got, you see, okay, so you've got a positive end and a negative end.
Yeah.
It's a copper wire with a germanium diode at this end, and it facilitates a one-way flow, a unidirectional flow.
Yeah.
So you would say, if you're doing Yin Chao Ren Mai, you'd put the red clip on lung 7 and the black clip on kidney 6.
Okay.
And then you'd leave it there for 5 or 10 minutes. But you'd also, for instance, if somebody was what Manaka would call, and what Japanese acupuncturists call, would be, if you have what they call counterflow chi, which would be rebellious chi or whatever you want, and they're getting hot flushes and they're anxious and their blood pressure's up, and you might reverse it. So I remember once years ago, I had a patient, she was in her mid-50s and getting lots of hot flushes, and I thought, oh yes, kidney deficiency, really, basically, or adrenal. You can translate that into Western terminology and say, well, the adrenals aren't producing enough progesterone and estrogen, because they're obviously, and they're getting, they're just adrenally exhausted in a Western kind of way of looking at it, but they're kidney deficient. And I put the normal polarity on of red clip on lung 7, and it suddenly induced a hot flush. And I went, we're sending too much chi up to the upper body. And I reversed it, and I put the red clip on kidney 6.
So effectively, if you go for Yin Chao Mai instead of Ren Mai, then, or
and it was like, she said, oh, that's better. And suddenly the hot flush just went like that. And I went, oh, wow. That within about 10 seconds, it was like that quick.
Extraordinary.
It was extraordinary. And I thought, oh, so I now bear that in mind, and we'll be talking about counterflow chi. I mean, it's a different terminology, but people know about, when people got reflux and, asthma is a classic thing, of people breathing up here rather than in the belly, those kind of things. It's just a slightly different way of looking at it compared to, but it's a concept that most acupuncturists will be familiar with.
Yes, I think so.
And I mean, one of the things that always interests me with Manaka is the use of the 8 extras, because I think there's a lot of people that use it more from a psycho-emotional aspect, whereas we used it almost more
Yvonne Farrell and people like that, which is really interesting stuff, actually. And Anne Cecil Sturman, who I've trained with a bit, and
it just seems to me like it's always amazing how Manaka uses it completely differently.
Yeah, but you've still got, obviously, I still incorporate that. That's probably where I've done a lot of reading. I've done training with Anne Cecil Sturman, even though I don't use that more Jeffrey Ewan kind of approach, because I'm firmly wedded to the Japanese Manaka styles, but it's got some very interesting information. But we know as acupuncturists that it's not, sometimes you treat somebody and it's very much, it's a physical thing, and then some people come up and it's more psychological, and some people it's more, how would I call it, spiritual, I suppose. So I don't know about at ICOM, but certainly Worsley would say you've got patients who come in with 3 levels of problems. And if you twist your knee, it's probably you slip on ice or something, it's probably a physical thing. But if it goes on for a long time, it starts to affect you psychologically. And then your choice of points will reflect that. So you try and adopt a treatment strategy appropriate to the patient and where they are now.
So how hard is it, Marek, to get your head around this Manaka style of practice?
I found it very easy, but I guess because I've always kind of, I think if you're wedded to a very, and here I don't want to sound anti-TCM because I've never practiced it, but if you're wedded to a more mechanistic reductionist model, you'll find it a bit more difficult because you're going to have to let go of that kind of, it's this, and it's kind of, I can see
Just
why.
letting go of that kind of certainty of, the signs and symptoms fit into a pattern with a descriptive set of points. It's letting go of that.
But there is certainty with it. What I like about this, the certainty is predicated upon what you're finding with your hands.
Yeah, exactly.
And your observation of the patients, because obviously that, as we know, there are several, looking at the person, palpation, listening to their voice, and all those things, their symptoms, they all feed into the diagnosis.
Yeah.
Even if you don't necessarily verbalize them, you know that it's part and parcel of what you're arriving at as a diagnostic model.
Yeah.
But it's flexible as well. You're thinking, okay, and you sometimes it's like, well, I could do this or I could do this, and I'm not sure. That's the other thing. Sometimes people come in with a very confused Hara, and you go, oh, I could be this, but there's half of this pattern and half of this pattern. And again, there are ways out of that, because I still get patients are thinking, oh, what do I do here? Do I do this or do I do that? And there are ways. You choose certain points to just clarify the abdomen. You leave them in for 3 or 4 minutes, partly based upon and the Chinese name for it escapes me, but you as an ICOM practitioner, stems and branches, which are the active points. Yeah. So anybody's done an ICOM training, you'll think, okay, I don't quite know what's going on, but let's look at which points are active at this time of day. And you put a needle in.
The open hourly points of this.
Yeah, all that kind of stuff. And then that would suddenly clarify. I mean, that's what I love about Manaka, because he incorporates lots of different threads from lots of other things.
Yeah, okay.
So he'll include
the diagnosis for that front part is effectively a kind of Hara diagnosis.
Yeah, very much. Yeah, it is definitely a Hara diagnosis, because
even though it incorporates kind of points on the ribs,
yeah, but
all just abdomen.
Yeah, I mean, I think you'll find with meridian therapy, which is very 5-element based, that Shudo Denmai teaches, and various other people, and Stephen Birch teaches the more non-insertion based version of it. It's still including points up here. It's not just the abdomen, it's also other points.
And is there a element of needing to be safe with the practice? That sounds like, you do the front and you do the back, then you do Sotai. Can you over-treat patients?
I think you can over-treat any patient. I think if you've got a very deficient patient, very much the maxim less is more. So you probably, that's the thing that Manaka talks about, is dosage, which I don't know if that's common in other styles of acupuncture. You talk about how long do you leave the needles in for? How many points do you use? How often do you see them? How much moxa do you use? How many, so, with a very deficient patient, if they come back in the following week and say, well, I felt great, but I felt exhausted, I probably overdid it. You can rein back. And I know it can be, we as practitioners go, oh, I can do this and I'll do this and I'll do this. I think it takes years sometimes to realize that although you think this might be a great thing to add in, it may not be what the patient needs.
Or intellectually, it sounds great.
Oh, yeah, but you, and that's what you get. I mean, I hopefully after, God, I mean, I qualified in I got my provisional license in 78. So I've been practicing this stuff for nearly 50 years, which weird because I'm only 45,
Yeah, it's a good stretch.